have faith in your vision of your future. And I think what I mean by that is a lot of times, especially for those of us who are like first gen, coming into like undergrad or college environment, it's like we have this idea of what we should do from what adults around us have told us that we should do. Because there's again, like there's even for people who went to college, they may have gone to college a long time ago. And so things are very different. And so there's the idea of like, yeah, this is how you do it. And that method may not even be applicable anymore. So I think definitely if somebody you have an idea of like, no, this is really what I want to do. I think I could be successful in doing this thing I want to do. And it may go off the path of expectation. Don't be afraid to do that because it can lead you down really great roads. I have a lot of friends who came in undergrad saying, yeah, I'm going to do exactly this. And then they found a passion somewhere else and they did a whole 180, ended up in a whole completely different field and are doing great.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 57. Hey everyone, Omari Richards here. Thank you all so much for joining me once again for another amazing episode. Before anything, be sure that you hit that like button, you hit that subscribe button, you hit that review button, and you leave a 5-star review, and you make sure to share this with a friend. Greatly helps me, helps the show get out to more people and help more people in public health navigate their careers. If you want to support the show, you can go to buymeacoffee.com/the PH Millennial and support there. This episode is a little bit different from others that I've had recently. Definitely, it's a recent graduate, and she's done a lot of amazing things, and is still on the looking for a full-time job. And I think that even though she is looking for a full-time job, her story is very valuable in itself. All the things that she's done, the leadership roles that she's taken throughout her career. And I look forward to seeing where she does go. I know most of you probably follow her on Instagram. And if you don't, definitely follow her after this episode. And we look forward to seeing where her journey takes her. And I know she's going to do a lot of big things, especially it seems like in the Black mental health space as well, especially for Black women. So tap into this episode. Hope you enjoy. Today we have a public health professional who was a former teacher. She got a Bachelor's of Arts in Psychology at Emory University. She then became a certified teacher and moved to Louisiana to work as a teacher. She moved back to complete her Master's of Public Health at Emory University, where she recently graduated from. Congratulations.
Thank you.
You're welcome. During her time there, she was a COVID-19 Student Task Force or Crown team lead and founder, amongst a lot of other things that we get to in the interview. As of airing, she's currently looking for a job to hook her sister up. And you may have heard of her on Instagram at Tiny Drops of Health. We have Bria Jarrell, MPH. Welcome to the show.
Hi, so happy to be here. Thank you for inviting me.
Yeah, my pleasure. I'm glad to have you on and to tell your story, especially as a newly graduate person graduating during COVID, end of COVID, whatever you want to call it. I think it's fascinating time, and especially like going through your master's of public health as well while COVID is probably a fascinating thing. So tell me, how are you doing, and how have you been coping during these times?
I'm doing well. I'm doing really great. Lots of free time, something I'm not used to. So I'm trying to fill it up with a bunch of different stuff. The main thing I've been doing that I've been trying to do for the past year that I didn't get to, but now I finally have time for is working out. It's not like I didn't have time to work out before, but I don't like working out alone. I like group workouts. So I'm back at the gym again doing group classes like multiple times a week, and I'm so happy. It makes me so excited to get in, even though I'm miserable during the actual workout. But it's solidarity, it's group misery, and that makes it better. So yeah, I'm just mainly working out, trying to figure out how to fill up my free time. So spending time with friends if they want to go do something. It's like, yeah, like let's go. I have nothing else to do.
Well, I hope you enjoy it while it lasts, and that you do get to enjoy and just soak up everything that is going on. So tell me more about like group workouts and liking that more than individual workouts, and how that all came about for you?
Oh, why do I like group workouts more
Mhm.
than individual? It's because I used to be an athlete in high school. So in high school, I ran track and I played volleyball, but I only ran track because our volleyball coach made me run track.
Mhm.
But I loved volleyball, and so I that was the first time I ever did like workouts and conditioning. And so we would have like conditioning like at the crack of dawn, like early in the morning. But it was always group stuff. Like you were never doing conditioning by yourself. You were always with the group. So I think I got so used to it that it just felt right and I preferred it. Again, like group misery, you're not miserable alone. And then whenever I got to college, I didn't do sports anymore, but I was on a step team. Emory undergrad has like a step team called like Nambika, and so it's like a girls step team for only for freshman year. And so that was also a group thing where it was like, okay, we're preparing for these shows, we're learning how to step, et cetera, et cetera. And so that was also a group process of like, yeah, we're miserable, we're tired, we're trying to prepare for this show that's like 15 minutes long, 10 minutes long, but we're miserable together. So I think it's just like I think it's the solidarity. I think it's just like, I'm going to be miserable regardless. Even if it isn't that hard, I'm still going to be like, ugh. But if I can turn to the person next to me and be like, this sucks. And they're like, yeah, this sucks. And I feel like better.
Fair enough, fair enough. And I think that definitely speaks to like community and having community and
Yeah.
how that's been important in your life.
Hmm.
So tell me, how do you identify, and then tell us a little bit about your personal background.
Well, I identify as a Black woman. And for my background, I'm originally from Zachary, Louisiana. I say Baton Rouge because Baton Rouge is easy. I usually just say Louisiana. Someone's like, "Where are you from?" I'm like, from Louisiana, and then people automatically go like, "Oh, you're from New Orleans," and it's like, no, 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 no. I'm from Baton Rouge, not that far, only like a about 2 hour drive, so not that far. I've been to New Orleans many times, but I say Baton Rouge because that's the most recognizable, but before New Orleans, but then I really am from Zachary, which is a very small town that's like in East Baton Rouge Parish. But like I went to school in Baton Rouge almost my entire like childhood, and then my mom worked in Baton Rouge. So we spent everything to do was in Baton Rouge. So yeah, that's why I say. But I'm originally from Zachary, came here, went to Emory undergrad, like you already said, went back home. Well, I guess we'll get more into that later to teach everything else. But yeah, I don't know. I think all the interesting details will come out later. That's all I
Yeah,
got.
yeah, fair enough. Thank you for sharing that. You're from Zachary, Louisiana. I'm not too sure where that is, but I will look it up. Um,
Yeah, it's small. It's a very small town. Very, very tiny. There's a little country. People would say it's the country. I don't think it's a country, but people would say we're from the country. So
yeah, I feel looking out or looking in from the outside is always different from being there, looking
yeah.
out from the inside. So
Yeah.
people have their different perspectives. So before
Mhm.
we get into the interview and well, more into the interview, what does public health mean to you?
I think the word, I think it's just such a hot button word, especially now. But I think the word that comes to mind is equity when I think of public health, because I think that's what my main thing when it comes to public health and what I look for, my goals and like my public health career at the end, I want to say at least I did something to help improve health equity in some way, somehow, for some demographic out there who's lacking health equity. And it could be a variety of different things. It could be in education wise, it could be healthcare access wise. But I think for public health to me, it's just increasing health equity and like healthcare access and things of that nature. I think that's what public health means
Yeah.
personally.
Yeah, I think that's fair enough. And I think that's an overarching theme and goal in public
Mhm.
health equity. It's definitely become a buzzword in some contexts, but
Yeah.
we definitely have to like push to actually get real equity and not just like
Hmm.
surface level equity. So I appreciate that definition. So you're from Louisiana, but then you went and got your bachelor's of arts in psychology at Emory University. So tell me about that thought process. Forget that.
Fun fact on my background.
Mhm.
That's where the details come out. I'm first gen. So I'm a first gen college graduate and a first gen master's graduate. So when it came to a lot of stuff with college, especially when it came to like academia, it was like shooting in the dark. Like I had no idea what's going on. I had kind of like I had gotten this idealized image of what it was. Like, oh yeah, like you just go you just say you're going to do this thing, you just go and you just go to class and you do it and you graduate and you're like done,
Mhm.
without really knowing like the meat and potatoes of like what goes down in academia. So I came in, I actually wanted to be a doctor. I didn't want to be a doctor, but I was like, I want to be a doctor because I was like, well, what's the career where you help people? Which is like 90% of us when we come into undergrad. It's like, what's the career you want to help people? I want to be a doctor. But then I was like, oh, I like psychology because I took like one psychology class. Well, we only had one psychology class in high school. And I was like, I like psychology. So I was like, I am going to be a psychiatrist. I was like, it all the dots are connecting. So I think it's funny the fact that I came in and I told my advisor that because like you say before, like, what's your interest? So I said my interest was psych. So they gave me a psych advisor. Um, and I had a conversation with her and I was just like, yeah, I want to be a psychiatrist. She was like, that's excellent. Like, that's great. I know all these psychiatrists. She was a psychologist. And so she was just like, I know all these psychiatrists. You could do like shadowing, da da da, da, et cetera, et cetera. And through a process of conversations and learning more about psychiatry, I realized what psychiatry was now and the fact that like, oh, this is not what I want to do. Like, this is not the process of what I want to do. Like, I'm interested in supplemental health, but I was like, I don't, because it was a lot of things are writing prescriptions mainly, and because of insurance changes, how the role of the psychiatrist has changed. And I was just like, no. So whenever I talked to her, she was just like, oh, from what you're saying, it sounds like you want to be a psychologist, not a psychiatrist. And I was like, yes. So I want to do that. Um, so I dropped the pre med and then I just declared psych and then kind of went along that process. And I realized I adore kids. I love kids. I didn't work with kids that much when I was growing up. But then, like, once I got to college and everything, I ended up working with kids like all the time. So I realized I really liked kids. So I was just like, okay, I want to be a child psychologist. And so I like took a bunch of like child psych classes, development classes. I also took some classes like criminal psych and other things, just things I found interesting. I think Emory has a bunch of great psych classes. But yeah, I just went through I started doing research and everything else. I was super into just psych. If it was anything psychology related, I was 110% invested. But I think also something that I don't talk about, and that's something that probably you don't know, is the fact that I put on my resume mainly that I do psych, but I also have a degree in classical civilizations. um and so while I was doing psych and everything else, the psych classes couldn't fulfill every single requirement that we needed. And so in high school, I actually took Latin. And so I learned some stuff about like mythology and mythos and everything. And so I had the psych classes filling up like 90% of my schedule. And it was like, okay, but you have other requirements that you feel like writing and everything else. And so I was like, well, let me take a mythology course. And then I took the first one. And I was like, oh, I like this. And I just added stuff on as electives to fill all the rest of my stuff. And by the time my senior year, by the time it was for us to like do the paperwork for graduation, like the department head emailed me because it's a very small department. And she was just like, you know, you have enough credits to declare. She was like, if you take Greek, you could get a full classics degree. If you don't take Greek, you'd already go ahead and declare classical civilizations. And I was not taking Greek. So I was just, I added that on too. So that's like my little add on. So I actually have a bachelor's in psychology and in classical civilizations, but the civilizations part was just for funsies, basically.
Okay, that's awesome. That's not something you hear every day. So what kind of things interested you in getting into that?
I think the biggest thing that interested me is always been like just mythos. I think myth has always been the main thing. Just looking at the gods in Greek and Roman theology and like how they function, what they were used for, what their purpose was, how they really reflected humans instead of, and that's kind of different than like how a lot of like modern day religions, like when it comes like versus like the entity that's like above all of us and like perfect versus these like Greek gods who are like were a hot mess all the time. I found that really interesting. And so I just love that. And then from there, you know, there's all like a bunch of like stories, like there's like the Iliad, there's the Odyssey, there's all this other stuff where they're interwoven into the stories. And so of course, if you learn about them, you have to learn about these other people and mythos and these other characters. You read the stories, and so it just ended up like all the knowledge is kind of building on each other, to where it was just like everything connected, everything made sense. It's literally like when you take one class, you take the other class, you're like, oh, I already know this about this story, here's the second part of this story, and here's a third part of this story. So I think everything connected so well, and getting to have discussions about, again, for funsies, like something I just think is just cool. um I guess just have conversations and be like, yeah, let's talk about this, let's talk about that, let's just talk about all these things that I found super interesting that I didn't really get to talk to anybody else about outside of like the department. A couple of friends who took classes, courses with me, and all the professors were so enthusiastic, like they were super enthusiastic to talk about like everything, as all professors are. But so like there would be times our office hours where I would go and sit with like a professor, and we would talk about like characters' motivations and things like that and everything. So it was just, I don't know, it felt really fun. I think with psych and classics, I think with both of those, it was just like I talked about them and it didn't feel like a chore to talk about those topics. It felt like really nice, really fun, and I was really interested in investigating more of those things on my own, whether it was be through like internet or whether it be through books. Like on this bookshelf, I have psychology books and I have classics books on this bookshelf back here. So yeah.
Okay, that's awesome. Well, thank you for sharing that. I didn't know that, wouldn't have
Mhm.
expected it. But I think that's
Nobody
awesome.
ever does. Nobody ever thinks like, oh, classics. Like never, nobody ever thinks of classics.
Yeah, yeah, yeah. But that's awesome that you're able to get that knowledge and be able to like just talk to people around it and get what
Mhm.
they thought around it and things like that. Tell me what it was like going from Zachary to Atlanta. What was that?
Oh my gosh, such a transition. Such a transition. I think whenever I start off, because I get that question a lot of like whenever it comes to like, and also like where do you want to stay like later on too. I always give the example of whenever I was in my freshman dorm with my roommates. We were like in a suite, so it had like me and my roommate. My roommate was from Miami, and she's originally from Haiti, but she had moved to Miami. And then we had our other roommates. One was from South Carolina, the other one was from New York. And so literally, I remember one night we were laying down, it was about to be time to go to bed, and we were just talking. And I remember one of my roommates being like, the one who's from New York, Sakio, she was just like, oh my gosh, she was like, it's just so quiet. And I remember just being like, quiet. Like you hear all those people talking outside, all those cars driving by. And then that, I feel like that was a moment where I realized, and that was my first time meeting so many people from so many different places originally too. Is the fact like the difference, like you said, like where you're coming from versus where you are, and like how different things are perceived. So I think it was a big transition because of the fact that it was exciting. I was like, oh my gosh, there's so much stuff to do. There's something going on all the time. There are things like right by campus, like the being able to walk off campus and go to like a restaurant or go hang out or just do whatever. Like all that just being right there. I thought that was the coolest thing ever. Having like the park just be something that was there and be nice as pretty as it was. I was just like, wow, like everything was just wow to me. Everything is still wow to me, honestly, in Atlanta. I'm still wowed. Um, but it was just like it felt like it was so much more here. And I think that's why I really like Atlanta. I think it's a nice in between versus some places that like because I have to think about like, oh wow, there are some places that are literally bigger than this and have more going on. And I think it'd be overwhelming for me. So I think Atlanta is a nice balance where like there's a lot going on and there's always stuff going on, but I feel like a lot of stuff is usually very chill and very just kind of like okay, like things are happening. Okay, things are done. Let's go back to calm time.
Yeah, and I think that that's a good perspective to have because I know a lot of people, probably a lot of people in public health, or if when they find out about public health on their journey, they might be coming from very small towns and
Mhm.
then ending up going to schools in a lot bigger places, and that transition in itself can be a shock for people. Do you have any advice if you would give to someone if they were transitioning from a small town to like a big city?
Explore. I think that's the biggest thing I could say, explore. I think that's why I enjoy Atlanta so much is that even though like it's so big, so of course I haven't hit everywhere yet, but I feel like in undergrad there were a lot of times where like if we got to go off campus and do stuff, I would be like, yeah, like let's like whether it was an Emory thing or whether it was just friends going off campus who are more familiar. I got to explore, and that's what helped me fall in love with the city versus just kind of staying in like one little pocket of one side and being like, oh, I'm only going to go here. So I say definitely explore. I feel like sometimes whenever people come from smaller cities too, they can get maybe nervous, like, oh my gosh, there's so much. They get nervous about exploring. I know I've talked to people about that before. So don't be nervous. Just like, of course, always be safe, but take time to try to be adventurous and really see what's going on in your city. And you might find some really cool stuff to do and to enjoy. Maybe new hobbies. There's always cool stuff to find in big cities, I feel.
Yeah, absolutely. And I think that that in itself is like a learning experience, just exploring and checking out new places and seeing,
Hmm.
as you said, like you was the first time in your life that you're meeting people from a lot of different places and
Hmm.
just hearing how they lived and how things have been different and just comparing and contrasting your lives are definitely something there. So are there any other takeaways that you wanted to share from undergrad?
I think one of the biggest things, I think I tell people this all the time, is like have faith in your vision of your future. And I think what I mean by that is a lot of the times, especially for those of us who are like first gen, coming into like undergrad or college environment, it's like we have this idea of what we should do from what adults around us have told us that we should do. Because there's again like there's even for people who went to college, they may have gone to college a long time ago. And so things are very different, and so there's the idea of like, yeah, this is how you do it, and that method may not even be applicable anymore. So I think definitely if somebody you have an idea of like, no, this is really what I want to do, I think I could be successful in doing this thing I want to do, and it may go off the path of expectation. Don't be afraid to do that because it can lead you down really great roads. I have a lot of friends who came in undergrad saying, yeah, I'm going to do exactly this, and then they found a passion somewhere else and they did a whole 180, ended up in a whole completely different field and are doing great and are loving it. I have people who started in the sciences who are doing fashion. I have people who started in the arts who turned to engineering. Like, like I just I don't want to say like just follow like your heart and your passion because I feel like it's very cliche, it's kind of cheesy, um but I definitely think if you're saying like, okay, I really have this thing that I want to do and I can accomplish that, then why not go for it? I think that's the biggest thing I could say. Why not try?
Absolutely, that's some great advice right there. So after you graduated from Emory, you went on to become a teacher. So what was it? What was the thought process for that? Because you said you wanted to be a psychiatrist, then a
Yes.
psychologist, and now just a teacher. So out of that, well, not just a teacher, but you became a teacher. So
I get what you mean. I get
yeah.
what you mean. Um, so after well, even before graduating, I was very burnt out. And Emory undergrad was like an academic beat down. I always say that. And it's like, I did it. I finished successfully, but it was a lot. It was something that I did not realize was going to be as challenging as it was. And so when I graduated, I had major burnout. So I was like applying for some fellowship positions, like in or like research positions and everything else. While I was doing that, I moved back home. And then actually, something that happened back home was in Baton Rouge in 2016. There was a major flood, and so because of the major flood, a bunch of not only spaces got wiped out, but also a bunch of homes got wiped out. And so a lot of teachers got displaced. And so because a lot of teachers got displaced, they were like requesting people to come in, like, oh, if you have like a college degree, or if you were a teacher in the past, whatever else, like we need people just fulfill these positions temporarily while we find permanent teachers. And so it was like a weird, like not a regular sub thing, but it was like a perma sub thing. Like, oh, we're gonna put you here for like a month, maybe 2 months, until we figure out what we're gonna do for this classroom. And so I decided to do that while I was applying for positions. So I was like, okay, I can make money while I'm applying for positions. And so I was the perma sub for elementary school for like a month. And then I was a perma sub for a high school for about 3 weeks while they were trying to find, I think it was algebra two. It was algebra two for high school for 3 weeks. And I liked it. I liked the high schoolers more than the little kids. I love working with little kids and like the like fun time, like let's play games context. They're so energetic, but school wise, like the older kids, I was like, yeah, independence is nice. And so after that perma sub position was done, then they just needed a short-term sub for like a week at a school called Scotlandville, Scotlandville Magnet Middle School. And so when I went there, it actually, the location listed was Scotlandville, but it was actually wasn't for Scotlandville. They were sharing a location with another school. So it used to be two schools on one campus, which was Scotlandville's campus, but the other school actually left already and they didn't update it in the system. So when I got there, I was like, oh, I'm here to sub. And they were like, oh no, this teacher isn't on this site. They're like, they moved already. So I was just like, dang, I was like, I'm at the whole wrong school. And so they were like, don't worry about it. They were like, it's their fault. We'll call it in, let them know that you did come and that, it was because they didn't update the system. So that's why you had the wrong address. So I was like, okay, thanks. They were like, but we are missing a math teacher today. Like, can you go in and just for today, like do like the thing with the kids? So I'm like, yeah, sure. Why not? So I go in, I think it was sixth graders I was subbing with, and I was working with them. And so the vice principal at the time walked in and she was like, just checking in, like, are you okay? Like, yeah, whatever. I was helping the kids with their work, showing them like how to do some problems on the board. And I guess subs don't usually do that because they were like, oh my God, like you're teaching us. I was like, yeah, like this is basic sixth grade math. Like y'all need help. I can show y'all how to do sixth grade math. Um, and so the vice principal basically saw me and she was just like, I really like the way that you interact with the kids. And she was like, and I think the kids like you too. And I was like, well, thanks. And she was like, actually, we have a eighth grade science teacher who's out, and she's been out for a while. She was like, like, would you be interested in taking over her position for the rest of the like semester? So like this is in early January. This was in January. So they're like basically to the end of the school year for that year. So I was like, yeah, possibly, yeah. So I came in to work with the eighth graders, and I think it just like clicked from there. Of course, there was some difficulty because you're like a person who's coming into a classroom where a permanent teacher hasn't been there for a while, and again, subs aren't doing anything. So they're like, you're like, okay, we have to do like real things now. They're like, oh my god, they're like, oh, like they're like, and at first they were kind of like of course there's the first like a little rough patch of like annoyance, but then they were like actually very happy to learn and very excited to be like, oh my gosh, what you're teaching us, like we're learning things again. And so I think it just clicked off so well. I really liked my kids, and I really adored my coworkers too. My whole eighth grade hall, I really like adored them. They helped me survive. And so that's how I started my first year with teaching. And I actually was not supposed to come back at first, but then over the summer, one of the teachers actually left, the teacher who was over video game design. And so whenever they were trying to figure out who to take her spot, they were like, she recommended me as a person because me and her had conversations about video games before. So she'd be like, oh my gosh, have you played this? Like, have you played like this? And I'd be like, yeah, but have you played this? Like, we had a whole conversation about BioShock, and she had never played it before. She was like, oh my gosh, that sounds amazing. So like she knew I liked video games. So she was like, oh, like, well, maybe you should ask her. And so I was like, okay, like yeah, I would love to do that. And then with that, I found out a little bit later on, it was like, well, also she taught engineering and she also taught agricultural science. So I did teaching three different subjects. The next year, whenever I came back, I was working on my teacher certification at the same time as I was balancing out like learning and teaching those classes too. So yeah.
Okay, that's awesome. And I don't want to miss the point in the story that you were being proactive in the class, like you came in as a sub, and as you said, subs don't really do much, but then you decided to take it upon yourself to actually go, and I think you said it was algebra, to
Yeah.
help with the algebra, and then the principal, vice principal saw you, and that's how it started. Because I think that's an important thing that people shouldn't miss, because you took that initiative to be proactive, to do work, to actually engage and help people, and people saw that value that you were giving there. Um, was it difficult for you to learn and teach? Because you said you did agricultural sciences, engineering, and
Video game design.
video game design. So how difficult was that to learn that, to teach it to people?
It was a lot. It was a lot. I think the easiest for me was video game design, and because also like I played video games since I was little. And so once I got older, I actually became one of those people who like I keep up with video game news. I keep up with like news about hardware, news about all that. So when it came to like video game history and things like that, like since I had a genuine interest in like building lesson plans for that was like the easiest at first because it was like okay, the history of gaming. Let's go. Like I know this. Let's go over all this. Let's talk about graphics. Let's talk about this. Let's talk about game development. Like these are things that I as in my adult life I keep up with. So I'm like, yeah, like like let's talk about that. That's great. And then the kids who usually, not all the time, sometimes they get thrown in there, but usually for video game design, it's a class that's in higher demand. And so those are kids who like they also like video games. They also play video games. So they'll ask 1,000 times. The amount of times I got asked, I've had $1 for every time I asked, "Do you play Fortnite?" Literally, like, no, I don't play Fortnite. That's not my type of game. Like, well, what do you play? But yeah, it was really fun because I think I loved video games, so majority of the kids also love video games, and so it was great. We also got to do field trips, so we did like a field trip to EA games in Baton Rouge. They got to see what that looked like, learn about like game developers over there. They got to see like an early trailer review of Anthem, which is sad because when it came out, it was terrible. The trailer looked great, but the game is terrible. A bunch of really cool experiences that they got to do and like pool projects that I got to do with them. So that was really easy. I think the hardest one was probably none of them came with a curriculum. Like none of them came with like here's your syllabus, here's the lessons, go. Like none of them came with a solid curriculum. So I think the hardest one for me was engineering. I think it was because like for video game designs, I love video games. For agricultural science, I was like, oh, this is interesting. And then we also had a community garden. And so there was a person who we worked with, well, there's another teacher too, who she helped me a lot. Like she's also, like I said, my coworkers are great. She helped me a lot when it came to the garden and stuff. So she gave me a ton of guidance. I couldn't have done it without her when it came to stuff for the garden and everything else. And also the teacher who was like, our classrooms are connected. He was really great too. He helped me all the time too when it came to like stuff for the garden. So I had a lot of assistance there and a lot of other hands there where it'd be like, this is what you do. Here's what you can plant. Here's what you can do, whatever to help me build my knowledge. So I had a lot of great mentors for that. But for engineering, it was kind of like, like, okay, like, yeah, there's engineering. Like you're learning about like engineering things, but it's like, okay, like what, like, engineering is very hands on. And so it's very much like, okay, like, what are hands-on activities that we can do to get y'all interested and get y'all thinking like engineers that are not just stuff in the book? Because I think a lot of times, unfortunately, with electives, it becomes like, oh, just do textbook work, do this worksheet, and that's done. And that's not how we functioned over there when it came to those classes. But it ended up being great. Like once we started getting more and more opportunities and like our like the staff, again, the other teachers I worked with were very much like go-getters when it came to stuff. Like we got a grant award to do a lot of different things, so kids got to work on learning about 3D printing. And then also they learned how to, like, we did a segment on like making like prosthetics with 3D printers. The principal of our school, she actually, her hand was missing, I think 3 fingers, and so like the kids worked on like doing a prosthetic hand for her, like prosthetic fingers. And that's something we worked on in class with a group of kids. We also had a group of kids my last year. Me and another teacher were over a project where we went and took the kids to Jerry Lane dealership and they basically donated us a car. And so their goal was to transform that car into an updated car, and we ended up giving it to the parent of a kid at our school. Also, these are all things that are Googleable. They're actually on Google. There are news articles about them. So like yeah, so like we really got to do some really big projects. We got to really expand the garden out into being something that's really nice. Now it has a fence around it and stuff too. So there's like all this. I feel like a lot of the classes that I did, I was happy I got to do those because of the fact that each one of them there was like a solid outcome. Like there's actually like a thing we point to and say like that's something that like my kids did, which was really amazing because I feel like a lot of teachers don't get that opportunity to really be like, yeah, here's literally a thing that my kids did that like is great and is benefiting people in some way.
And I would be remiss if I didn't ask, what is your video game system, your preference in video game systems, and your favorite video game?
I'm a Sony baby.
Okay.
So I it's so funny. I always say I don't think my mom expected life to go like this. When she I don't think because I think actually my papa, I think my mom I think it was my mom's idea to get it, but I think my papa is the one that got it for me. But yeah, she's like, oh, like, whenever I think I was 6, I was 5 or 6. She's like, okay, let's get her a PlayStation 1. Let's get her some games on that too. Some platformers. I had like Crash Bandicoot and Rayman. I had Barbie Race and Ride. That was a thing. Um, but yeah, so I got that, and then from there, I just loved video games. There used to be a video game channel called G4 Network. I think they're rebooting it now. I think they're gonna make it be a thing again. But like that also fostered it too, because like I'm also playing video games, and then G4 existed, so it was like I would watch TV shows about video games. And so literally it started. I think it became like an easy gift after that. Like, oh, okay, like, and then the PlayStation 2 came, and then here's some games. And then the PlayStation 3 came, and my mom was like, this is the last console I'm buying. And so, like, from there just grew. But I like a variety of games. I think, well, now I have a PlayStation 4, but I only bought it 2 years ago. So I bought it at like the later end of the PS4 life, but hopefully it'll have, I think PS4 has some more years on it, especially because people can't even get PS5s right now. But sometime in the future, I'll probably get a PS5 once the PS4's game life is like done. But yeah, I have a PS4. I also have a Switch. That was a gift from a friend though. It was a gift from a friend last year, during the pandemic, so we could play Animal Crossing together. So yeah, so I have my Switch, but I have like Animal Crossing and like Cuphead and other things on my Switch. And then my PlayStation 4, I have a variety of games. I like games like BioShock, which I like first person games more than multiplayer games. It's just because I think it's less hassle. And I like story. I like games with story. So of course, like that first person experience. So I have like some of my favorite games are like the BioShock series, the Batman Arkham series, that whole thing, Arkham Asylum, and all those games. I'm a big Batman fan. The newer Spider-Man games. I like JRPGs. I like a variety of stuff. There's a lot of variety on my console.
Okay, thank you for sharing that, and shout out to your mom and papa for getting that system, because at the same point in time when you're saying all this, if they never gave you that system, maybe you would have never wanted to know about do the video games class, video game design class,
Right.
and then as well as not wanting to get into the classical civilization, because like the storytelling and that,
Right.
maybe that all played into your role, and I would say it did. So
Yeah, no, video games were big for me. I think I don't know what type of person I would be if I I had never played video games. Like my one of my college essays, we had to do essays for Emory undergrad, and one of my essays, we got a choice in the question. It was like who my question I chose is like who is your role model, and it could be fictional or real. And my role model I picked was Lara Croft, who is the protagonist of the Tomb Raider video game series. So yeah, so like video games really like are like a big thing for me, like to this day.
okay, awesome. Well, thank you for sharing that and sharing your passion around video games. And you were the assistant director at Oak Trees Camps, and this was also while you were teaching, I believe. So, how did you get
Yes.
this, and what did you do, and how do you balance all of that?
So this, I feel like everything I get is just by like Maybe my next job would just be like by like just random circumstance. Every job I've had, I said that in front of every job I've had has been random circumstance. Actually, whenever I was in undergrad, my freshman year, I had work study. So I was trying to find a work study position that was kind of easy and good to do. So a lot of people work at the gym because there's a ton of positions. Mainly people would be card swipers. And so I was like, oh, I want to be a card swiper. And so I applied, and so they just needed me to do the paperwork. But then a hurricane hit Louisiana, and so my mom couldn't send my social security card. And so since she couldn't do that, like the director at the time, he was like, "Well, I can't really like hold it up. Like we have to get like there's a deadline." But he was like, you can go talk to my colleague. And he was like, my colleague always has positions open. And so I went to go talk to him. His name is Elijah. He's great. And I still talk to him to this day. And so I went to go talk to him. And so I was like, hi, my name is Bria. I can't remember the director's name at the time. I was like, he sent me over here to ask about a position. He was like, yeah, position's open. And so I worked under him and I built like a really great relationship with him. He was a great boss. And so he was like, I really like your work ethic. He was like, I have a camp that we have on Emory's campus during the summer. Do you want to come work for my camp? And I was like, yeah, like, like, of course, like I'll come work a summer job. And that was my first summer job that I ever had. And so I worked there at Oak Tree for I think 3 years in a row. And then I took one summer off because I did research, like a research program. And then when I came back, he was like, how would you feel about being a co-director with someone else who had been working at the camp for a while? And I was like, I would love that, sure. And so I became a co-director. And then I was a co-director for a couple of years after that. And so he really, but what he always says is the fact that like it was from my hard work. He was like, he knew that he could trust me to do things and like trust me to like be in like higher positions. So that's why he recommended me to do the co-director position, because he was like, I know that you work hard, I know that you could do good work. So he was like, I want you to work in this position with us. So that's actually how I got there. It's just circumstance, and then we got to know each other, and then he put me in this position because he trusted me.
Yeah, and that definitely goes to show that you put in that hard work. You're being proactive, just generally. So what sorts of things did you have to do as a co-director or assistant director of a camp?
So we did a lot of stuff on the back end that counselors don't do. So on the back end of like actually prepping and figuring out like, okay, what are activities that we can do, actually figuring out what supplies we think we're gonna need, choosing staff and going through the process of having picking out staff, figuring out different things related to like once camp started, like if we had issues with any campers, how to deal with that, training staff, guiding staff, basically like overseeing everything. And sometimes like if staff, like if something happened, we had to step in as counselors, or staff like got sick one day, we had to step in at that counselor role for them at that time. But mainly we were the go-to people because we would be the ones that would always be there. The actual like heads, founders of the camp, they couldn't always be there in person, but we would always be there every single day for anything. So if anything happened, like injuries or issues or parents need to be contacted or everything else, we coordinated that. We also coordinated like early pickups, early drop-offs or late drop-offs, aftercare, a bunch of the money stuff, like on the like back end with little like extra stuff. So we did like basically all the back end working stuff that we were like allowed to touch. We handled all of that. So that on the front end, counselors would have an easier time and parents would have an easier time. And me and like my co-directors, because I had the same co-director 2 years in a row, and the third year I had a different co-director, but we all worked like a well-oiled machine. So it all was like really, really great. I had a great time. It was a great position. It was fun. I think it was a nice balance of like interacting with the kids. They would always see you and you would check them in and interact with them like all the time. So you knew who the kids were, but not being a camp counselor is not having to like run around with them like all day and play the games with them all day. Like it was that nice in between of like, okay, let me do administrative stuff, but also get to interact with the kids and the counselors too.
Yeah, it sounds very, very awesome. It sounds like very rewarding, and you said you get to get your I guess your dose of kid
Yes.
fun without without too much of it
Yes.
in there. So tell me about the process of hiring and how you all went through that process, because I know you're probably a young lady at this time and you're looking to hire people, and a lot of people don't get to hire people until they're a lot older. So Can you just talk about how you all thought through that process?
I think for us, it was more of a thing of, at least in our role, because they would, so like the heads would get all the applications in and they would like lay them all out and let us look over their resume and how they fill out their application. And also I think they had to do like a questionnaire things of like, oh, like with this and this and da 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 da, or if you did this and you did that, da 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 da. And so I think it was really interesting to look through and trying to really go through and be like, okay, from my knowledge, from my experience, do I think this person would work well with kids? But then also it's kind of like hard because there's always situations somebody could look really good on paper and look excellent on paper. Like, oh my gosh, like, yeah, you have experience. You were a camp counselor before, you've worked with kids before. The other people who have been teachers, and you would automatically think, like, oh yeah, you're gonna be great with kids, and they get there and they're not. So I think that was part of the learning process of looking at applications of being like, okay, this person sounds good on paper, but let's look deeper. Let's meet this person. Let's meet these people. Because at first we didn't get to meet the candidates beforehand. At first we didn't have any part in hiring. It wasn't until I think my second year as a co-director that we actually started taking part in seeing their applications and whatnot, and having a say in that process. But I think it's always nice to I think it's always great. Well, I'm a people person, so I think for me it's always great to get and see and talk to someone face to face and getting to have that interaction, and then from that vibe being like, okay, like would they vibe well with kids, would they not vibe well with the kids, and kind of say like their enthusiasm with learning things, their willingness to ask questions, like, everything else. So I think with the whole thing, it's like a constant process of checks and balances, but in the end with hiring, it's like you can never 100% be certain, because some people really, it's like seems golden all the way down, and then you get to the situation, then it's like, oh, like, no, no. Like there are some people who, it's like enthusiasm, right? You think of somebody's like bright and fun and enthusiastic, you're like, yeah, it's great, your energy is great, your resume is great, and then it's like, oh, but now you're like with a group of kids, and then like it's like you're one of the kids, and it's like, no, we can't have that. You have to be an adult. Like, we love enthusiasm, we love the fact that you want to play games, but also we need you to come down just a little bit. So yeah, it's always, hiring is such an interesting process. But I think it's just that you can never be 100% certain. So it's really trial and error and learning kind of like the patterns of like what makes a good employee for that position and what doesn't.
Yeah, and I think that is invaluable experience in itself because a lot of people just don't get that kind of experience and don't get to see things from that side of the table. So I definitely think that's awesome. So after those two roles, you started your Masters of Public Health at Emory University. But before I get there, like, when did public health come into like your world, your mind, wanting to study public health? Because I know you said that you wanted to do psychology, or like
Mhm.
psychology was your interest before. So when did public health pop up for you in life?
So public health pop-ups for me after really working with and getting to know my kids and getting to know their lives. And I think the biggest reason for that is because public health has that prevention aspect. And so I think a lot of the time, well, not even think a lot of time, we know like prevention has been ignored for a very long time. And so when it came to interacting with my kids and seeing things with my kids, it was because the school that I was working with, it was a magnet school, but it was also a Title I school, which meant that a large percentage of our student body fell in the category that where they would get like free resources, like free things like free lunch and other things. And so a lot of our students, the majority of our students came from low income backgrounds and low income neighborhoods. And so you could see that reflected in whenever they would come in the classroom. For a lot of our kids, that free lunch that they got at school was the only lunch they were, or maybe the only food they were getting all day. Some kids would come into school exhausted because of the fact that they weren't getting sleep at home. Some kids were the babysitter for all their siblings whenever they're home because their parents had to go and work multiple jobs, like situations like that. And so there was so much going on with our kids that it would be like, oh, well, this is going on with your kids. And so you could send them to like recommend to send them to this person or send them to that person. But the thing was, like, at our school, we had like a nursing's office, which a lot of schools don't have. We had a nurse's office with like actual nurses in it, beds, all that. Um, and so a lot of times, okay, you can send your kids to the nurse's office, but in the end, it's like you can't send every single kid to the nurse's office within a school day. That's impossible. You can't, like, there's not enough nurses. We had three. And so like you can't do that. It's like, okay, you have a situation that's going on with the child emotionally. Okay, we have a counselor. Okay, but we have one. We have a social worker, but we have one. And so there's a lot of situations where it's like, this thing of like take action, and okay, yeah, you could do this and recommend your kid to go here, but it's like, how can you have 300, 400 kids go to this one person when we know the majority of them, almost all of them, have the same additional needs? So it became a thing of being really frustrated in the system and seeing a system to where it was like, well, yeah, like, be like, we have the resources, well, or like not the school itself, but like up higher entities being like, yeah, you have a nurse's office, you have the resources to, like, send this or send them here. And it's like, no, it's not enough. It doesn't matter if you brought 10 on, if you brought, we had 10 nurses and 10 counselors and 10, what, it still wouldn't be enough. And that's when I started to realize that, like, this action side of it, and like kind of like I started looking at, like, at myself and my goals and being like, okay, I could be a child psychologist, but it was like, how many kids can I impact on the whole as a child psychologist versus me wanting to impact a group of kids? Like, if I was a child psychologist at my school, like, I could only impact so many kids at one time, versus if I were to do something like mental health programming or something like that, I can impact a group of kids at one time. I can impact 50 kids, 60 kids, 100 kids at one time. And so that's when I started to question that aspect of what I wanted to do. And then also look more into, like, okay, like, what are things, like, whenever it came to like dressing food insecurity, like, that's something we talked about in the classroom. We talked about food deserts. I taught my kids about food deserts and why things like community gardens are important, everything else, and kind of a bunch of the lessons around that, a bunch of lessons that were relevant to the kids, or the lessons in public health, the lessons in agricultural science, the lessons in the additional projects they were doing. A lot of them had a relevance towards public health, even though they weren't directly public health. They connected in public health some way. And I think I just naturally ended up reading more into public health and seeing things about that. And then once I really started to look into, like, okay, like, what are careers where I could do the things that I want to do to impact populations of people and populations of kids, or not even the kids, but maybe their families, their parents, instead of just one-on-one like psychologists would. And that's when I learned about public health and what it was and different things that people in public health do. And so that made me turn and look at public health. And then, of course, as I Google public health schools, then it's like, oh yeah, Emory has a school of public health. And I actually have friends who were at Emory School of Public Health. But before, I like, oh, like, you're at School of Public Health, like, that's great. But I didn't know what that was. I didn't know what they did. But then actually learning about it and then talking to them about Rollins and everything else and how much they loved it and what they were doing and their goals, where I was like, that aligns with what I want to do. So that's how I fell into public health. So it's really working with my kids and getting to see firsthand, like, not just some data in a book, not just, a lecture in a classroom, but actually getting to see firsthand how my kids were being impacted by health disparities and being like, this is horrible. I don't want, like, my kids shouldn't be having to deal with this. Their parents shouldn't have to be dealing with this. How can I address or do something to help address, like, these health disparities on a wider scale versus just like the kids in my room, or there's so many kids in my room that could be impacted.
That's beautiful. Well, beautiful in a sad way, but
Yeah.
so beautiful in the way that you were able to find this career path, this field where you can actually impact populations, really work upstream, and really work for prevention to all these issues that did see pop up with the kids that you were working with, and really do it in a kind of sustainable sort of way as well. So, what was your concentration at Emory?
At Rollins, my concentration was behavioral science and health. Well, they changed the name. I always start with the old name. Let me correct myself. It was behavioral science and health education, but they changed it to behavioral, social, and health education sciences. So it used to be BSHE, now it's BSHES. as like the little abbreviation. So yeah, behavioral, social, and health education sciences was my concentration. And I took a lot of courses related to mental health.
Mhm.
But there's a certificate program, but I didn't want to be constrained to the courses of just the certificate. So I just took a bunch of mental health classes and just didn't take like the one extra required one to declare the certificate.
Okay. And was it mental health classes more because you were like you were already on the psychology side of things? So was that something that just like resonates with you more?
Yeah, for sure. I think it's also the fact that I still want to do mental health related things, psychology related things. It's just I want to do it on a wider scale. So I think the mental health classes definitely helped me learn in that aspect. Like, for example, one class was like mental health and the medical interface. So it was like seeing how mental health, well, the history of mental health in the medical system, and then how mental health facilities and stuff actually function in the medical system when it comes to things like insurance and how insurance coverage has changed for mental health needs, and how mental health services actually are typically like distributed and where they fall in line versus like other healthcare needs, and the fact that like certain things are separated. Like for example, like I had no conceptual idea in my brain that like services for substance use disorders are usually actually separated from other mental health services. Like that's not something I knew until like taking those courses like that. And then other courses that like help me learn more about like mental health or mental illness prevention, or things like mental health programming, like all these opportunities I got to build around my knowledge of mental health. And so it kind of supplemented what I was doing in my other classes, like the core classes, where we had some leeway to like, okay, you get to do a project on covering whatever. So like my projects would end up be mental health focused. They would just be focused more on a demographic. So I did a lot of projects on Black women's mental health. Or I did another project that was on like college student mental health and patient mental health, like in who are like inpatients, like stuff like that. So I know I want to do work in the long term related to mental health. So that's why I fell into mental health again once I got to Rollins, because it was just kind of all clicked with what I knew I wanted to do.
Okay, and that makes sense. Okay, so we're gonna go through these positions that you had while you were at Rollins. We have five different ones. So you definitely kept yourself busy, which is like insights in itself to anyone who's in their Master's of Public Health program. Keep yourself busy as much as you can without stressing out. So the first one, you were a public health intern at the CDC in the Department of Global Health Protection. So how did you get that, and then what did you do?
I got that from back when we actually used to have physical career fairs. So they had the career fair in the spring. And so I went around looking, because we have to do like, well, the APE requirement, everything else to graduate. And so I was kind of rolling around and looking around. And so I just walked by the table for Leidos. And so one of the recruiters there was like super friendly. And she was like, hi, she called me over. She was like talking to me. She's like, are you familiar with Leidos? I was like, not at all. Never heard of it. I don't know. She was like, well, this is what we do. And she's kind of explaining to me like what Leidos was. And she was like, well, we have a public health intern position. And I was like, oh, like I looked at it, I was like, oh, that sounds interesting. And she was like, well, the application's due tomorrow. I was like, I'm not gonna get it in tomorrow. And she was like, just send it to me by next Monday. And I was like, I could do that. And so like I went in and I don't even think I did like the full application. I think she was just like, she was like, just send your resume, just send your resume. And so I sent my resume in to her, and I was just, I just kind of like, it wasn't even a thing of, it's so weird with the Lattice position. I was very much like approached it as in like, they're just going to get me as I am, because like I kind of looked at my resume, and of course I made it neat and everything, but I was just like, I don't have the time to go to some resume person and get this fine tuned. So I was like, I'm just gonna send it, like it is. And then from that, they were like, oh, we want to interview you. And I was like, awesome. For the interview, again, it was a thing of like, man, I don't really have time to sit down with like, do some interview practice, this and that. So I really like the day before the interview, I was like, I'm just gonna go in there as I am. I want to go in there with my own energy and just, be honest and, just be me. And if they don't like me, then, it's not meant to be. If they like me, they like me. And then I went into it. We had some technical difficulties at the beginning of the interview process, but I got to sit there and got to talk to all of them, and I got interviewed by Leidos staff, and then they liked me. And so I was one of the two, there were only two of us, two public health interns for the Atlanta area. And I was really shocked when they sent like the stats. They were like, oh, there were like over 300 people applied this position. I was like, oh, I was so like shocked because I think, it's a thing of like, wow, I really just sent like, just sent in my raggedy resume and just kind of came to this interview just, you know, organic, just being me, and all kind of worked out. So I think it was very much kind of like a fate thing. So I ended up in the Department of Global Health Protection under the Global Health Security Group, under my boss Cynthia, who she's great. She's also, I have great bosses. I have a good track record of bosses. I realize how lucky I am. And she was awesome. And she was just like, it was a lot of, well, we had to wait for 18,000 years to get the CDC clearance. That took ridiculously long. I got hired in April. I got hired in April. The position was supposed to start June 1st, and that didn't happen. No, it was supposed to start like May something, and that didn't happen because it took them like over a month to get me CDC clearance. And then I didn't get my laptop until like July. So it was just a lot. Like everything that they were like gonna have me do, they were like had to like loophole it in a certain way. They were like, well, you can't access this on your computer. So you can't do this. We're gonna have you do this instead. And then once you can get it, you get this. So that was a lot, but it was great. She was great. She was very patient. She was also very much about like teaching, like, oh, okay, like I want to teach you how to do this. And she was very much, you ever need help, like let me know. If you ever need like resources, let me know. So she was like, before I even started the position, she like sent me all these PDFs of like all these things about like the JEE standards and everything else that was like guiding the work that they were doing, so I could read over all that before I got started. So that was great. It really, I feel like, again, good bosses. She really helped me get caught up to speed. I was in that position from June to August, because I still got to do my 12 weeks, which I was happy about because they weren't sure I was going to be able to do it, but they were like, oh, we have plenty of work. So I got to do that. So I was really happy. And I got to meet some other people too under the department. Unfortunately, not in person at the time, but over like the phone. And we would always do like weekly meetings, and they would also have like fun like weekly meetings and be like, let's just talk about like stuff. Like, here's like somebody had to make up like an interesting question and to ask everybody. Everybody had to go around and give answers, and we would do those like twice a week. So it was great. It was a really good time. I learned a lot about global health because global health is not my concentration. So it was very much like in left field doing global health stuff. But I really enjoyed it. I really liked it. It was super interesting to learn something brand new and learn a lot more about the CDC too, and like how they function and their different headquarters and different locations and all the like the CDC affiliated countries and all that.
And once again, I don't want people to miss, like, as you said, there were like 300 people that applied for the job, and you thought that you were like ill qualified for it. And you were one of the two public health interns that got picked for it. But I think that has a lot to do with that warm handoff with that person that you met. Probably greeted them with a big smile. And you're probably feeling that energy a lot. And as you said, like this, they said tomorrow, you're like, oh, I can't do that. And then like Monday, and they will help you out in that. I
Mm.
would, at least I would think that they helped you out for you to get that, especially considering everything that you said. So that's awesome, and that's just advice to other students who might be trying to do other things. I know like physical job fairs might be coming back soon,
Yeah.
so definitely look for those warm handoffs and get those connections and relationships built up.
The
Um,
fun I You just made me remember the fact that physical ones are coming back. I'll never forget the fact that at that job fair, the CDC was there. They're always looking for like fellowships and ORISE fellows and advertising that stuff. And I'll never forget the fact that the CDC was the only table that would not shake hands. I'll never forget that. I will never forget that. They were the only table that refused to shake people's hands. They stood with their hands behind their backs. They were like, "Hello, how are you?" Oh my goodness. Yeah, they had Gerbex at the table too. Like they knew. I think they said they had come from like a briefing or whatever, because everybody was like looking at them like, okay. And they were like, we just came from a briefing. And it was like, okay. And it's like, oh, and then everything shut down. But they knew everybody else was shaking hands and everything else, but the CDC table. The CDC table was the only table where they were like, no. They're like, here's some Germex.
That's kind of funny.
It's hilarious. It's not funny, but it is funny.
Exactly. I agree. Agreed. So that also during your time in Emory, you were a Emory Housing Graduate Assistant. So
Mhm.
talk about that.
Unfortunately, I only got to do that for a year, not even the full year because of the pandemic. I only got to do that for a full semester and then a couple of weeks. But I was working with them to like just do a bunch of back end stuff related to housing, like when it came to like assigning rooms, also like clearing rooms that maybe where people did switches with roommates, doing like making sure people who had like certification. So if they had like a I'm forgetting the official term, but like a support animal and like the documentation for that, like making sure all that was aligned, make sure all that clearance was in. So it was a bunch of clearance stuff that I did on the back end, but I had like a physical cubicle and everything, and everybody was so nice. So that was sad. But like once everything shut down, they were like, we don't have anybody on the campus anymore. Well, they did, but like it was a very small amount. So they were like, they didn't need the position anymore. So everything got shut down. So I didn't get to do that for a long time, unfortunately.
And then you're also a Center for Women Graduate Assistant.
Yes, got to do that for the full 2 years. Happy about that. Yeah, that was great. My main role was with a program. It was a new program that they had just started, Black Women in the Wilderness. So it was a program basically focused on getting Black women into the wilderness, but with the goal of not only building like knowledge of like outdoor skills and abilities, but also like a mental health component because we know from the research that like Black women are not really going into like the actual physical psychologist office as much, especially when it comes to like college age Black women, and that's for a lot of very obvious factors. um and so because of that, we were looking at, or my bosses created it before I got there. My bosses created it with the goal of trying to one, get women into the wilderness more, but also two, to get Black women more into like mental health related things and self-care related things without them having to go into a traditional psychological setting. And so the first year we did an actual retreat in Helen. We went out to, I always say it wrong. I always say it wrong. So I know I'm going to say Unicoi State Park. I always would say it the wrong way. My boss would always correct me. But we went out to that state park, which is very big, very beautiful. We had a cabins. And so they did like, what was it, zip lining? We did zip lining. They went on a hike. Oh, they learned archery. They were supposed to do fly fishing, but because of the weather, they could do fly fishing. And then we actually had like a psychologist who was there. And so we had like moments where we got to talk about like mental health related things. We talked about what it was like to be a Black woman on Emory's campus, be a Black woman in general. And so it gave them a lot of the space to, and everybody who was there was a Black woman too. Like the staff, all the staff that was there were Black women, and all the participants were Black women. And so I gave them time to like be with other Black women with these experiences. So for a lot of them, built like a very big comfort zone, but then also getting to have these conversations that usually they don't get the space to have whenever like outside of the setting, like on campus or like anywhere really, to sit down and like have these intimate conversations in like a very judgment free zone where there's also resources for you if you need them, in case anything happens. So yeah, it was great. We were supposed to do it again, but then pandemic happened. And so we had to change it to where instead of doing a retreat, because we couldn't like go and take them, we did like sessions. But they have the limited gathering numbers on campus. And so we did sessions where like in the spring this year, where they like each session had a different theme. So like one, they learned how to like, we also bought them all the supplies so they wouldn't have to pay for supplies on their own. So for like everybody that participated in these programs didn't have to pay money, because we also know that's a big factor that limits Black women going into outdoors also. So we gave them supplies like backpacks, the little like mini cooking kits. So we had a session where like they learned how to use the little mini cooking kit. We had a session where we just went on a hike and like talked, and for some people that was like their first real hike. We had sessions where they learned about forgery. Oh, not I keep saying forgery, not forgery, foraging. I have a bad habit of saying forgery, and I'm like, no, it sounds terrible. Foraging. They learned about foraging. That is a session where they learned about foraging. They did yoga outside, things like that. We're also getting them things where they have like home plant kits where they can like plant things at home, all these supplies that they can use if they want to ever go out in the outdoors. So we were lucky that we got to do it since everything was going so well on campus. COVID wise, we didn't get to do all as many sessions that we wanted to, but we still got to get them done. So we still got to accomplish it this year too. It was just a different version of the Black Women in the Wilderness type program that we did the first year where we had the retreat. But yeah, I really loved it. That was my primary role the entire time was the graduate assistant working with that and just coordinating stuff for that and actually physically being with the girls for stuff for that too.
Yeah, that sounds very fulfilling, and I think it's very important for that mental health wellness work to be done. And I think there should be more. It's a Black woman in the world. There should every university I feel like should have that club, or like every city should have something
Mm-hmm.
like that, because I think that is great for community and just
Mm-hmm.
support and just a lot of different positives come out of situations or projects programs such as this. So that's that. Thank you for that good work. And then I know you're wearing the headphones that you got from the podcast that you did while
Yes.
while you were at this in this role. So tell me a little bit more about the podcast that you did, and or the podcast that you all did.
Yeah. So for my job, because of the pandemic, we were trying to see different ways to still be able to engage with people. Because before, like we had like our physical space, and our physical space was always something we made super accommodating. So we would always have people, even if they were doing nothing, just come in, chill out, talk, things like that. We always had this great environment for people to come hang out with us. So since we lost that, we were trying to figure out how to recreate that. And it was kind of hard to recreate that. And so my bosses came up with the idea of doing a podcast. And so they brainstormed all these different topics. And basically we would all volunteer to say, like, oh, like I want to do this topic, I want to do that topic. And we would all sit down and just have like a very like now like a very natural discussion about like a topic that we brought up and just kind of rolling through it from the perspectives of all these women of different ages, because it wouldn't just be the undergrads. So we had undergrads, we had me and another grad student, and then there was also our bosses. And so these different people in different positions in their life, but also people in different age groups sitting down and having discussions about these different topics. Sometimes they were just pop culture related, sometimes they were more I don't want to say more serious topics, anything could be serious, but like more like sometimes more political topics, sometimes more social justice related topics. But we had a lot of variety. We had topics related to Black women's well being versus like, topics about like Avatar The Last Airbender. We had so many different topics about like what it's like being an undergrad, what is it like being in grad school, like just things that we knew that people who were at Emory, if some people outside of Emory too listening, would just be able to sit down and really enjoy, but also connect with. And so I think that was super beneficial. It's the first time I'd ever done a podcast. And that's the first time many of us had ever done a podcast before. And it was just great to like in the lead up time to it, but also just to sit down and really have these conversations and go back and listen later and be like, oh wow. Like, kind of reflect on like what you said, what you think. And like also have those moments too where sometimes we have those different perspectives or those chains of perspectives, like in the middle of a podcast and things like that. So I really enjoyed it. I really enjoyed having those conversations. It's on Spotify. Oh shoot, I would have to send you the name. I'm blanking
Yeah,
right now.
no problem. We will link the name to whatever the wonderful podcast is in the show notes. So no worries about that, Bria.
Yeah.
And then in another role, you were the Crown team lead, which I have written there. So COVID-19 Student Task Force team lead
Yes.
and the founder, if I'm correct.
Yes.
Cool. So how do you go about becoming the founder and the team lead for this?
This happened. So I remember when everything shut down because I was actually on campus when the emails were sent for everything to be shutting down. It was during spring break. And so I remember getting the email about like, oh, spring break's gonna be extended for a week. And I remember everybody else being like super hyped, super excited, be like, oh my God. And I was just like, oh, I don't like this. It's like I don't like this feeling. And it's funny because the ADAP of like our department at Rollins, she reminded me that I said that like this semester. She was like, I remember whenever you emailed me and you were like asking questions, and then you were like, I don't like this. And she was like, and then everything happened. Like I was like, I don't like this. And then everything shut down completely. And I was just like, oh no. And so when everything shut down and then kind of because COVID was already a thing, but I think everything shutting down really put COVID in perspective for a lot of us and made a lot of us who maybe because they were actually already having sessions at Rollins talking about like, oh, what is COVID-19? Or before it was COVID-19, like, what is this new like, epidemic that's coming up? What does this mean? How are we handling this? Like there were sessions that we were having at Rollins about that, just from a public health perspective, like like a public health like student, like, ooh, like this is interesting. But then it became like something that directly impacted all of us. And so I think the thing that bothered me the most is once I read about everything and I got to see the impact of not only like that, but also school shutting down and everything too on students, I was just like, I feel like there should be something that we should be able to do, because I was like, we're in public health, like this is like our thing, like this is literally our field, this is our topic. And so I saw that I think it was Harvard School of Public Health had like group to where they were doing like calls, like informational calls. Like I think they were doing like a call center thing where they were doing calls to like check in on students and things like that. And also people who like diagnose and be like, oh, like, do you need anything? Things like that. And also like information about like COVID-19 resources, stuff like that. And so I saw that and I was like, that's interesting. And so I DM'd the page that posted it, but I never got a response back. So I was just like, okay. I was like, well, I want us to do something. And so I came up with an idea and I posted on Emory's Facebook group. And I was like, hey, I was like, y'all, I was like, I was like, I really think it would be great for us to get together and do something, like something to whatever to help with the pandemic. And I had a big response. Like a bunch of people were like, yeah, I would love to coordinate something too. It was just a whole bunch of positive feedback. And so that's when one of the admin at the school actually was like, hey, shoot me an email about this. And so I shot her email. So we had a whole conversation about it. And she was like, I like these ideas. And so she was like, send me what you're thinking. And so I just throw a whole like laundry list of like, here's all the things that I think that we could do. And I sent them to her. She was like, this is great. She was like, I love this. She was like, we can get this together. And so she also graduated for Rollins. So she took like Joanne took like her like public health skills and made like a whole like little branch. So she came up with the crown acronym. And so like each like letter represented something. And so she was like, here are the different groups of things that we could do. And so she was like, and we have students who are interested. And so we picked from that pool of student names. We made like a Google form or whatever. And so sent it out. And we had like, I think like 60 or 70 responses from students before like the day was out. Like within 24 hours, we had like that big of a response if people wanted to do something. And so we had different teams broken up into the task force for people to do things. We had a research monitoring team, we had like a student well-being sector, everything. And then we also had other student orgs on campus like sort, who were doing work already too, who kind of like funneled in and were doing work with that. And so it turned into something that was really great. And we had multiple student leaders who were had their own goals of what they wanted to do with the different sectors. And so we got like a lot of great things accomplished. So it made me really happy. I wasn't able to do as much like on the front end, like as like a direct worker side, because I was working on my thesis. So I was more on the like, oh, like being in meetings and being like, okay, like this is what we're doing, this is what we gotten done, and being like, great job. But in the end, like they didn't really need me because it was just like they were doing such a good job. It was a really great group, and it still is a really great group, and they still have it, and they're still like expanding on what they want to do and figuring out different ways to get students involved and everything. But yeah, it was really just came from the fact of like the pandemic set in, and I was just like, this is what we do. We should be doing something, coordinating anything. And so that's where the idea came up for me to really for us to do Crown. And then it was supported by admin and approved and greenlit. And so it was a very streamlined process to get everything done.
That's really dope, and it just goes to show like you see the issues there, and then you just you what is it? You said it was some sort of forum that you reached out and like, oh, should
Yeah, the Facebook page. Mhm.
yeah, and just like putting that information out there and realizing that, oh, other people are also interested and think that
Mhm.
we should be doing things as public health people, as this is a very much public health issue. So
Mhm.
you're like, kudos on you for taking that lead and just putting out that question, because if you didn't, who knows if this would ever happen. And just from that, the administration getting kicked in and all this wonderful work that still continues to this day after you graduated, I think that's really dope. So
Yeah. I always like to give the kudos to the students, like the main workers,
Mhm.
because like in the end, it's like, yeah, I came up with like the like idea on the front end, but in the end, like they got the work done. Like they were doing like literally like the research monitoring, the emailing, the coordinating, like creating like stuff or like informational stuff for students, the post surveys. Like they were doing so much. So I think I like to give a lot of the main focus or the main praise to them because they really like they hit the ground running with all the ideas that we had and like made it happen plus more. So yeah, it was really great.
Yeah, that is great, and I'm glad that you said that you took time to like kind of step away from it and focus on your thesis, because
Yeah.
as we've spoken about for the last half an hour or so, that you've been doing a lot of stuff, and definitely think that that was mindful of you to do that, to not like overburden yourself with the work, because you did come up with a great idea at first, so don't downplay that either. um, but yeah, so the last position that you had when you were Emory was a graduate teaching assistant.
Hmm.
So talk about that position.
I was a teaching assistant for the fall and the spring of my second year. So for the fall position, it was a research methods course. And so the professor actually emailed me, another student, and asked us like, "Hey, I had y'all in mind. I'm getting two TAs this time. Do y'all want to be TAs?" And she was like, "Well, just so you know, it's an in-person course." So I love the professor. One, I love that class. I love research. So literally when she asked, and then also I like adore the other person that she asked to. So it was like all like yeses. And I got to be on campus. So I was like, yeah, of course. Like I would love to come TA this class. Like, I get to be on campus. I'm getting paid. Like, I like this class. And then also just from experience of being a teacher before, it was just like it didn't feel like something that would be like, oh my gosh, like TA. I was like, oh yeah, teaching assistant. Like, yeah, I'm cool with that. So it was awesome. I really loved it. I happy that I did it because it was the only time I ever got to interact with first years. And for a lot of the first years in that class, they were like, you're like, I've talked to them after the class was done. Like I talked to some of them this semester and be like, you're one of the only second years that I ever got to know. Um, but I think it was great. I think I really liked it because of the fact that the first years lacked a lot of the support that we got. Like we had a good relationship with the class that was above us who had graduated. So like we got to learn a lot from them, interact with them, and kind of skill build and learn about opportunities from them that this class didn't get because they get to be on campus majority of the time, but the second years didn't have that option for a lot of their classes. Only had like maybe one or two options they could do a semester that were on campus. Um, so I really enjoyed it. I really enjoyed being able to get in and really help second years, not only with like this course stuff, like not only with like them building their research skills and their research paper writing skills, but also like other things that they maybe needed. Like there were some who wanted to do a thesis and they were like, what is that like? There were some who were like, well, I'm looking for an APE and I know where to start. And then to talk to them about that. I think I got to be in kind of like that guidance role that I kind of like I told somebody asked me like if I could be their mentor and I was like no, but because I don't like the permanence of being like a mentor because I feel like I have so much of my own stuff that I'm like doing, so I never want to commit to something that I'm like I don't think I'll be able to give you 100%. But it was like, but if you ever need guidance or have questions, like I'm happy to ask. Like I'm happy to for you to come ask me, or I'm happy to ask somebody else for you, or to be a connector for you to maybe another mentor, like somebody who can be your mentor. So I really enjoyed it. And I just love the fact that I got to be like Thursdays were my in-person days. Like I had my only one in-person class that morning at an hour break and then I TA'd. So I got to be on campus all Thursday and it was just great and I loved it and I got to see people in person. It just made me so happy to be in person and to see people and interact with people directly and just see people like watch the students learn and grow. Um and just be great. Like a lot of them too, I think another great thing is like a lot of them have so many different research interests. And getting to see those papers, they get to do a paper on whatever, like whatever topic they want to, that's public health related. So they have papers on like reproductive rights, reproductive justice. There are papers on like when it came to like racism and like swimming skills. They had papers on, you know, diabetes, and it came to like new technology addressing like the needs of people living with diabetes. Like it was like a bunch of different papers with so many different things, and it was so great to learn, like see like their different expertise that they had, and like talk to them about that, and them be like super passionate about their research topic, and kind of like watch them kind of like flourish with that over time once they learn to build their skills. So yeah, and then in the spring I was with the public health. It was like they have like the professional development courses that are mandatory, and so we were TAs, but we were the head TAs over other TAs. So we didn't talk to the students as much unless they needed to reschedule or something. We talked to the TAs who actually talked to the students. So yeah.
Okay, yeah, that's awesome. That sounds like a great experience right there. So just tell me a little bit like how you balanced all of this. I know, like you said, that you didn't take up too much on the lead for the crown position just because you wanted to do your thesis. So what other things did you do to balance all of this?
I think the biggest thing was the fact that time management is huge. I think time management is one of my sometimes it's one of my weaknesses, but also it's one of my biggest strengths too. Like when I really get down, I'm like, okay, I need to hit all this. Like I was able to do it. There were a lot of times though I was really stressed out, especially pandemic. I've said this probably a million times. I'm a people person, so not having people all the way around me when I'm doing stuff with everything, it like really stressed me out. But I think the biggest thing was just kind of like really just kind of like picking what's priority in the moment, and it's like saying this thing is my priority right now. I'm focusing on this. This is it, and I'm not going to focus on anything else until I'm done with this. Um and kind of like doing that like on rotation of being like once you pick a thing to focus on, making that the one thing that you focus on, and then rotating out, but doing that with a combo of time management to where you're still getting everything done. But I think also realistically too, I had a lot of grace from professors, and I think a lot of professors were doing that this semester and last semester too. And so I was very transparent with my professors, being like, hey, I'm doing my thesis. I'm also working, and I also have this. Plus, there's a pandemic. Like I'm tired. And I'm lucky to have professors who were like really, really awesome with that, and were like, okay, like I don't care if you take another week to do an assignment, or like a lot of professors in general for like stuff. They would be like, a lot of hard deadlines got thrown out the window, and they were like, all these deadlines are soft now. We just, as long as you get it done by the end of the time, then it's okay. So I think that was a big part of it too for my personal balance, was the grace. If there are any professors listening to this out there, grace is a huge thing. It's very helpful to the students and their success, of like students knowing that like, hey, if I cannot get this done on this exact day, it's okay. It doesn't mean I'm a failure. It doesn't mean that everything's going to be done. I'm going to get a zero or whatever, or whatever. It like actually having that grace and know like it's okay if I have to prioritize something else was very helpful.
Yeah, and I think it goes to speak to you also being proactive on the side of saying and reaching out and let them know that you have all these things going on, plus the pandemic, and them being empathetic enough to understand and give you that grace and give others that grace as well. So that is awesome. Are there any other lessons that you wanted to share from your MPH being a recent graduate?
Just I don't know, practice self-care. I feel like one of the biggest things is probably see it everywhere, all over your social media and everywhere else. But in all seriousness, you cannot function well if your body or mind are falling apart. It's not how it works. They all are interconnected. And so for you to be your best self academically, or work wise, whatever else, you want to make sure that you're doing the best by your body and your mind too. I think that's my bit of advice.
Yeah, I think that's great advice, especially for people probably still in school right now, dealing with
Yeah.
the pandemic or the end part of the pandemic and how horrible that is. But I think that's one thing that I think I've shared a couple of times on this show. Just a lot of people have learned the importance of self care during the pandemic. So thank you for that great advice. So I know that you're currently working on some sort of research paper, journal paper. So how do you get involved in this, and then what has that process been like for you?
The paper is actually on the Black Women in the Wilderness program. We did like like we had like a data part of that to where we're looking at like their ratings for different factors related well-being before they did it and then after they did it. So I'm looking at that, and also I did papers in my program in my research methods class on like wilderness programs and the fact that how like that's just not a topic that's looked at when it comes to black women or just in general. There are actually there's more research than you would think on like mental health and wilderness programs, but none of them have black women. And so I mainly taken like that I did on that paper, and then also the data that we have, and then also probably updated new research and putting that all together to try to basically create a paper that is publishable that looks at not only like what we did, like here's what we did, and here's how we did it, and here's why we did it, but also here's the results, and here's why this is important to possibly look at. So it's been a good process. I haven't been working on it that long, but I started working on it like in the middle of this month. And actually, my job got me a book that was like how to write like a journal article. I think like in 13 like weeks or whatever. Um, and so I've been going with that to try to learn like the process of like, because I had like from classes experience of writing like articles or like article manuscript type format things,
Mhm.
but like this would be my first like real one. And so I'm looking at that for a lot of the guidance of like having my step by step process and going through that.
Okay, that's awesome. I look forward to seeing that. Hopefully, it gets published sometime soon. And let me know if you want to hop back on the show to like talk strictly about that, and if you want to get anyone else.
Sure.
Yeah, we can definitely do that at some point in time. Um,
Sure.
yeah. So moving on. So where I met you was on Instagram, on your account at Tiny Drops of Health, and
Mhm.
I think that Instagram was a great place for any public health professional to get on right now. But what made you want to create this Instagram account?
So I created the Instagram account. I actually created it on was a New Year's Day. I launched on New Year's Day 2020. And it was something that I played around with in my mind like in December, but you know how you have that thing of like, oh, you want to perfect something, like wait, but no, I need to perfect this, and I have to have this concept down. I have this concept down before I start something. And I like really like kind of took a time to like beat myself out of that and be like, let me just start it. Because if I wait and try to perfect it, it's not going to happen. And so I started it mainly because of the fact that we talk about a lot in class, because again I'm in behavioral social and health education sciences, so we talk about like health communication and things like that a lot in a lot of different classes. That's something that comes up, and something that we talked about a lot is the fact that like a lot of health communication sucks. It's terrible. uh, and the reason why it's terrible is because a lot of time like it's just not approachable, and a lot of times things are not clear cut and understandable, or sometimes in a way like people trying to be clear cut like ends up being confusing. So the fact that there's like a lot of public health like communication, unless it's coming from some like wider entity that like is like a very very professional entity that's like, oh, this is literally like the CDC, like this is what we do. But from everybody else, like, you know, maybe your local news station, or maybe your local other Instagram user, sending out a lot of confusing information, a lot of pseudoscience, a lot of things that are not, you know, they're misleading or not backed by anything, but people are claiming are backed by things. Like there's just a lot of misinformation and just bad communication happening. And so I was just like, you know what, I want to make a page where, you know, just talk about like different public health things, and, you know, I'm very clear cut with it, make it understandable, make it something that people can read and share really quickly on Instagram. That's why Instagram is also my only social media. But, you know, I felt like Instagram was the best place where people can literally share graphics of things and everything else. And it's very much like controlled, a very controlled environment. And so I just started it, and I was just like, okay, like, hey, like, let me do little posts. Because I think my first couple of posts were just like little like motivational post related things. And then I started doing like in my brain like theory Thursday, because I was in a theory class. Our first semester we had to do like a theory class, public health theory. And so there are so many theories that are like the health belief model and like, you know, things like that I was like, okay, like let me do those. And my professor, like I told her like, oh, you know, I'm like, like using the theories that you taught us and making Instagram posts about them. She was like, oh my gosh, that's great. She was so excited. And so at first it was just kind of like, yeah, like, I'm just throwing out these posts about like different public health related things, like some motivational things. But then it all transformed again because the pandemic happened. And so it was so interesting because I've had people ask me who like followed the page later or found out about the page later, like, oh, did you make it because of the pandemic? And I'm like, actually, no, I made it before the pandemic, before I knew that was going to be a thing. It just ended up being like not a happy coincidence, but a useful coincidence. And so some of my posts then that started being more popular, of course, because COVID was a thing, talking about COVID-19. So I had like a post that was like, here's what zoonotic diseases are, and here's how they work. And because there was a bunch of misinformation around that. Also, I did a post talking about the stigma and like anti-Asian stigma and being like, no, this is not the China virus. This is a zoonotic disease. Like there's a million other ones that exist, that have existed before this. Like, no, this is not a thing. And so just there are so many different posts related to COVID that I made at first, and just like actually COVID like itself. But then also I started doing some posts because people's behavior was upsetting me. People's behavior was upsetting me. People's language was upsetting me during the pandemic. And so one of my biggest posts, I think I got like 2,000 something likes, was a post that was like, stop talking about COVID as though like it's a thing of like, oh well, it can't hurt me. So because I found that very frustrating. I found that very frustrating as a person who has lives in a family with many people who have like comorbidities and like multiple like chronic diseases. And I lost a family member to COVID too, like in that spring. And so it was very frustrating to me to sit there and watch people basically talk about like tell other people like, oh my gosh, like stop being like a baby, or stop being scary. Like it's not going to kill you. And it'd be like, yes, but one, first of all, yes, it can, but also two, it's harming so many other people. And people just not caring. It was like, okay, like maybe y'all are ready to sacrifice grandma. I'm not. Like that's not the vibe that I'm on. We're not on the same wave. And so I made a post with that, and that resonated with a lot of people who were living with some type of illness or disease that like made them immunocompromised, or had family members and loved ones who are immunocompromised, especially a lot of moms. There were a lot of moms with children who were immunocompromised who were like, thank you, because there are people who literally don't care. And like, I'm scared for my kid. And so I started making some other posts related to COVID, but there were like more mental health aspects of it, like people using a lot of stigmatizing language of mental health with COVID, and just like it was just all bad. It was just there was so much that was just off. Not only with our government at the time, and the way that they spoke, but also just media and things like that, and just everyday people and the way that, and a lot of influencers too. Like a lot of influencers on Instagram were just like I was watching them be like, y'all are flagrant with it. Like y'all are just saying whatever, and your viewer base may not know any better. And so they're just eating up what you say, and it's putting people in danger. And I think that was very frustrating for me. So I think that definitely like steam or like made like really like hyped me up and made me want to make like more and more and more posts, like even in the midst of the pandemic, because I was just like, no, like people need to see these things, people need to think about these things and everything else. But then I also started expanding out to not as only COVID-19 related stuff, but then also other mental health related stuff, different like days that are recognized, or weeks, like health related weeks that recognized, like weeks related to like mother and child health, talking about like stuff on those weeks, or mental health related weeks, talking about suicide awareness week, like things of that nature, how the pandemic was, affecting doctors and everything else. And again, more language for communication stuff. So I think it was just, it became an outlet for me to be like, okay, hey, I'm seeing a lot of this nonsense. And even though I'm seeing a lot of nonsense, instead of me going and like battling it out in comment sections somewhere else, like I have this Instagram where I'm like, okay, like, hey, I've been seeing this is not great, let's talk about why. Or hey, this is a thing, maybe you should think about it. Like another big post I had was, oh, people comparing COVID-19 to chronic diseases. That bothered me too. That got under my skin. And because I knew people personally who had done that also and had those conversations. But it's just all this, I don't know, just language and like being, as people, we have to be better about how we say things, how we communicate things. And I think that's super important. And so I think that became my space to do that on my own and to say, like, hey, let's think about when we say things like this, or like, hey, when we spread this type of information, what are we doing? Or just also giving praise where praise was due. I had one post where I was like, hey, when it comes to like demystifying the vaccine for Black people, it's mainly been other Black people, Black healthcare workers specifically, have been the ones who have been like, yeah, let me document this for you, because a lot of bigger public health entities have not been doing what they need to do to still try to demystify the vaccine for Black communities. Um, when that should be their primary role, and they have the funds and the resources to do that. So yeah, I think it's just become an outlet for me to just whenever I don't want to say it's just whenever I get frustrated, but a lot of times because when I get frustrated, where I'm like, okay, y'all, people are annoying me with misinformation and just really harmful things. And so I was like, let me put something out there so at least the viewers who are looking at my content can get it, or they can share it to other people. I think that makes me happy. It makes me happiest when people share the post and other people resonate with the post, because I know it's helped some people feel seen. I know I've had people DM me personally and be like, your posts, especially on the mental health related posts, they're like, your post helped me feel seen, thank you. And I think that's very validating. It makes me happy that there are people who see my content and who are like, I'm happy that someone is talking about this and like expressing the way that they feel when they may not have the outlet to express those things themselves.
Yeah, and I think that that's powerful in itself. But I would like I like that you said like it's a place for you like to find not vent but kind of vent because
Right.
I remember talking to Amanda Howell. I want to say it's like
Oh yeah,
ep-
Amanda. Yeah, yeah, yeah,
yeah,
Amanda.
episode
She's
21.
great.
I think it is. And what she says is she literally just goes through Instagram and whatever she says that kind of like gets her upset. She
Hmm.
write down something and she make a post
Right.
later on. So like I think there's a lot of validity and in that, as well as that's the kind of things that people want the information to, or they might just have the misguided information, and just getting
Right.
that information could be very enlightening to them. But then I think it goes. This all goes back to your earlier point on like health education and just
Hmm.
especially in public health education, we just are not there yet as
Yeah,
yet.
we're not.
And but I think it's admirable as you for you as a student to start this, and I think this is going to be more of the trend of public health people just trying to share the health information in better ways and things like that. So I think that that is really awesome, and I look forward to seeing more posts and you keeping up this page. So definitely be
Mhm.
sure to follow at Tiny Drops of Health. Um, so
Yes.
what have you learned throughout like just doing this? Because it's been over a year now, maybe a year and a half.
Yeah, about a year and a half. I've been on a short hiatus, not a short hiatus, I'm on hiatus
You do you,
for
girl.
like, I've been on hiatus. I haven't officially been like, hey, I'm on hiatus, but I've been on low key hiatus because of my thesis, and so my posts then were kind of like sparse, and then graduation, and then like decompressing after graduation. So like literally, my posts have been more sparse, but I'm gonna be starting back up again probably next week. Um, but I think the biggest thing that I've learned is just, I don't think it's like not like any like grand moral lesson or like big like insightful lesson, but it's just been like, I don't just learn how to adapt and change. Learning how to adapt and change. I feel like because I went back, and because I'm like I said, I'm glad that I didn't wait to like perfect something before I try to like jump on it. Because that never works. You can perfect something and you're gonna change it anyway. But it's funny because I have like an aesthetic or whatever now. And it's not really just because like I want it to look good, but also like to be easier for viewers because of a lot of different reasons. Sometimes visual reasons, sometimes colors can be like a lot for some people. And so like having more like duller colors, more neutral kind of tones, so that it's more friendly for more people to read and to share and to actually be able to see. um But just in general, like I remember looking at like the aesthetic now and being like, okay, my like neutral tones, my browns, whatever else, my spacing, my more consistent fonts, everything else. And then like scrolling down, looking at my old post and being like, oh God. Like it is just like a rainbow of color, like an attack on the eyes. And I was like, oh my gosh, like I was really sending out posts with like bright yellow backgrounds and everything in like red font here or whatever. I was like, that was nonsense. But knowing how to adapt and grow and like knowing how to look at what you're doing and what you're creating, being like, okay, do I need to pivot? Do I need to make a change? Do I need to make a change how what I'm talking about? Do I need to make a change how I approach it? I think also I've just learned in general because I was always a person, like I've always been a person that's been more let me think before I speak type person. But I think especially with the page, me being like critical of like how I'm communicating information. Because again, like this is like a page where I'm like, I want to make sure that I'm not just throwing out nonsense. I don't want to be a person who sends out misinformation. I don't want to be a person who sends out pseudoscience or other things that are, misleading or could be harmful to somebody, or somebody might use my page to argue something that's wrong and be like, yeah, because she said if you eat an apple a day, then you will never get sick ever again a day of your life. Like I never want to be that person where somebody's like arguing something that's like blatantly off with my posts. And so it made me be more hypercritical about like what are my sources. I always make sure that my sources are, if they're not the primary source as in a journal, then they're like a direct secondary source as in like the CDC, who got the information from some study or their journal or some health site that literally also cites like we got this directly from this journal, things like that. So it made me more critical of where I'm getting my information from. It made me more critical of how I'm like expressing or sharing information, because sometimes I'll type something and be like, that might be confusing, and then going back and redirect it. There'd be a whole post that I've been like, let me redo this whole thing, because I was like, no, I do not want to confuse anybody. I feel like that's unclear, and everything else. And so it's made me be very hypercritical about how I navigate my communication with others and how I send out information with others, because I want to hold myself to a standard when it comes to the type of posts that I make and things that I share. Because of course I'm gonna have silly posts of like, oh, like I went to go get ice cream. I think I like posted myself with a friend getting ice cream one time. Of course, like there are gonna be those moments, or like, oh, like I'm on a boat and my feet are like in the water, like things like that. But when I'm like actually giving out health information, being very, very critical of myself and my posts, and like reading my posts over a million times, be like, is it clear? Does this make sense? Sending to some other people in advance to be like, how do you feel about this? How do you feel about the language in this? But also thinking about like who I include whenever talking about things too. There are topics that I have not touched on yet and I haven't made posts on yet, just because I have not been able to talk to anybody directly who would have direct experience with those topics. And I'm happy that I haven't covered it yet, because it made me realize like I didn't just be like, oh, here's a topic, I'm just gonna jump on it, as someone who doesn't have experience with these topics at all. So it made me think about like reaching out to others to have more people come on and like talk about their experiences with different things, like talking about things like eating disorders. That's something I don't have experience at all with. That's not my expertise public health wise. I don't have any lived experience with that. And so like talking to people who do have those experiences, and when it comes to posts like that, and topics like that, and other topics that may be sensitive, and also talking to people with different identities. Like whenever I did the post about like that had dealt with like stigma against like Asian identities, like I actually asked friends, it was like, how do you feel about this post? And they were like, oh no, I think it's good, like whatever else, like having the getting that double check, the system of checks and balances, and checking myself and knowing like who I am and my identity and my experiences, and making sure I'm always checking myself when it comes to what I'm sending out, that I'm not speaking over anybody else, or I'm not jumping in anybody's role when it could be someone else's, or should be someone else's priority time to speak and not mine. I'm just, for some people, I should just be the mouthpiece. I should not be the main speaker, if that makes sense.
Yeah, yeah, absolutely. Respecting people's space and giving them
Mhm.
space to be themselves and show up and share their experiences authentically, I think is very important.
Right.
Something I just wanted to point out once again, you said that you wanted to make this Instagram profile and you thought you have to make it perfect. But when I think like when people think perfect, it's perfect to maybe you, but like
Right.
to the person viewing it, they
There's
don't
no
really care.
perfect.
Exactly. So
Right.
it's like just put it out there because it might be perfect to someone just how it
Mhm.
is right now. So I just wanted to share that there. Is there anything else you wanted to share about tiny drops of health?
I guess if you just go and check it out. For the people listening, go and check it out. See if you like it. If you like it, drop a follow. I promise I'm going to be active again. I know I haven't posted in a little while, but it's just been kind of like a mental break time. But I promise I'm gonna be active again for sure.
Okay, let's hold Bria accountable to that. This episode should come out after that week that she said she's gonna start. So if you listen to this episode and you don't see Bria post, go on her Instagram, DM her, and
Yeah,
say,
call me out.
"What's up,
DM,
girl?"
call me out. Say I listen to the podcast. You said you're going to post again. Call me out.
Awesome, awesome. Look forward to more posts from you.
Please.
So moving on. Where would you like to see yourself in the future?
Oh goodness, where would I like to see myself in the future? I've asked myself that a couple of times this summer because I feel like it keeps changing. But I feel like because I'm very much it's like the thing. What's the saying? A jack of all trades, but master of none. But
Mm,
better than a master of one. I think that's the full statement. But it's just like I can see myself in so many different places. But I think my main thing is I want to be somewhere where I'm making positive impacts on some population's health. I'm not very. I would love for it to be Black women's health specifically, but I'm not. As long as I'm making a positive impact on individuals' health in general, that I'm happy. So I would love to be in a position where I can make direct impact on population's health, but also be in a position where I could do that, but also have flexibility. I feel like one thing, and my boss at the Center for Women has talked to me about this before. We've talked about this like multiple times before. I don't want to become a martyr for public health, if that makes sense. I want to be able to do the things that I need to do. And of course it's gonna take time and take effort. And I'm very much willing to put in that time, those effort and that sacrifice. But I also want to be able to live my life and enjoy my life too, whether that be travel, whether that be time with friends, family, everything else. I want to have that balance of like, yes, I'm doing meaningful work, but I'm also living a meaningful personal life as well, and find that nice balance in between. So
Absolutely, absolutely love that, and I definitely hope that you're able to find that. And I think like you're already in the place where you're doing meaningful work, and you're going to be doing a lot of more meaningful work. So it's just to find the balance on the other side. So I look forward to seeing your journey and seeing how all of that unfolds.
thank you.
You're most welcome. Moving on to the Furious Five, the five questions I ask all guests.
Mhm.
Number one, what advice would you give to a student trying to pursue a career in public health?
Keep your interest open. I think a lot of people try to say like this is the thing, this is the thing, this is it, I'm sticking to just that thing. And I think that's not realistic. I think you learn so much and there's so many different avenues within public health, and also so many different ways to meet the same goal. Whether you're like, I want to improve women's health, you can do that through policy, you can do that through programming, you can do that through evaluating things that already exist.
Mhm.
um you do that through research. Like, there's so many different avenues. So I would definitely say keep your interests open and allow yourself to adventure into different aspects of public health. You'll probably find something that you didn't know that you liked.
Awesome. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Unemployment. Oh. Quit your job. But no, no, I'm kidding. I'm kidding. I'm kidding.
I didn't even think.
Oh, oh my goodness. No, for someone who would be trying to get into my position, I'm going to say as graduate. Let me see. As someone who want to get to my position as a graduate, I would say just my main advice would be just don't give up. I feel like it's cheesy, But I know definitely in my program, and especially again because of the pandemic, they were very challenging times. And there are times where be like, oh my gosh, like I'm doing all this. And it's like, yeah, I'm about to be done, but oh, there's such a long way there. Um, don't don't give in, keep pushing forward, but also remember why you're doing what you're doing. I feel like remembering why you're in this program and why you're working towards this graduation, it'll be the main thing that'll help push you to get there in the first place.
Awesome. Great advice. Number three, what's something you're working on improving in your life right now?
I'm not gonna say employment. Um, what am I working on improving? I think just well, my social skills. Let's say that my social skills. Let's say that. I'm a very, as you can see, I'm a very social person. I love social time, but I feel like because of the pandemic, like some of my social skills got stunted, low key. And so I'm working on getting back outside. I've been fully vaccinated for like over a month or 2 months now. And then, I think I'm trying to work on getting back out, interacting with people more, exploring Atlanta again, because things are opening back up now. Physical locations are opening back up now. So that's what I'm trying to improve. I'm trying to improve just my social time. Oh, that's a good one. I'm improving my ability to just do whatever I want to not be dedicated to just doing work, but actually learning how to use my free time
Okay. Awesome. Love it. Love it. Number four, professionally, do you recommend anything?
professionally. Um, I would say professionally. I guess I would, because I'm that's a thing with me in public health. Like I actually don't listen to many public health podcasts. I don't read many public health books or watch any public health YouTubes, which is interesting. I never realized that. I feel like a lot of those things are reserved for like my other interests. I'm really big on like crime shows. So like I have like listened to a ton of crime podcasts and read crime books or fictional crime books and watch crime shows. So I would just say professionally, I would say Instagram pages like your Instagram page, Amanda Howe's Instagram page, what's a good one? Say When. That's When's Instagram page. Oh my goodness, there are other ones. There are so many good ones. They're on my. I'm following them, but I can't think of their usernames off the top of my head right now. But there are so many. Just look at the list of people I'm following. I'm not following many people. Look at that, and then find the personal public health Instagrams on there. There's a lot of great ones that I follow who do excellent work. Um, and give out excellent information. I think social media, especially Instagram specifically, has become a great place for like public health professionals to go out and really get information out there and do a lot of health education related stuff. Especially around a variety of topics. Some people doing stuff with food insecurity, some people doing stuff with dismantling diet culture, some people doing things with different chronic disease, da 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 da. So I definitely say look at my following list on my Tiny Drops of Health page and look at who I'm following and then see if any of those pages interest you.
Yeah, great advice. And I think the advice about looking, well, as you said, you don't really pay attention to public health things, like looking outside of public health and things like that, and just being interested in things outside of public health is advice in itself. And it translates to public health in weird ways that you would not even realize. So that is
Right.
great advice. And last but not least, where can people connect with you?
Tiny Drops of Health. There, right, that page right there. Tiny Drops of Health is where you can find me and connect with me. I don't have any of my other contact information up like that. So if you want to contact me, or you want to contact me and get in contact with me like more personally, like over email and stuff, just DM me at Tiny Drops of Health, and then we can just move on from there.
Awesome, awesome. Well, thank you so much for coming on the show, Bria. I appreciate your story and all your insights that you shared today. I enjoy talking to you a lot too. Hopefully, you can get back your social cues and everything back in order for getting back out there in Atlanta. And I hope to see you sometime soon as well.
For sure.
Yeah. So some housekeeping items. Everyone, thanks for watching or listening to the show. Be sure to subscribe, like, review, and share it with a friend. If you want to support the show, you can go to buymeacoffee.com/the PH Millennial. And I will see, well, you all will see me next or hear me next week. Public Health Millennial out.